Now it's my pleasure to introduce the next discussion in our programming, one that's been highly anticipated here at Psych and by many in our psychedelic community, a fireside conversation between Christian Angermayer, founder of Atai Life Sciences, and Rick Doblin, founder of MAPS. As many of you know, Christian and Rick are inarguably among the top leaders in the for-profit and nonprofit psychedelic arenas, and it was important to us to get them together to discuss a few topics around the crossover of for-profits and nonprofits in the space. We hear about some of the friction points between the two sides, and many are asking how both can work together in this space that is becoming increasingly competitive. Now we'll open the floor to Rick and Christian for their thoughts.
Yes, hi Christian, and congratulations on the successful IPO. It's fantastic.
Yes, so I'm pretending to be super alert. I'm a little bit exhausted, but it was really good, and so I'm in a true meaning really happy.
Yeah, because I'd say the main difference between our nonprofit approach, which I started MAPS 1986, 35 years ago, and we've raised about 115 million in donations. But over the last couple of years, the for-profits have raised well over $1 billion. So the access to capital is one of our limiting factors, and you've just done great with the IPO. So, how we navigate that is a challenge for us, and just a good factor for you. So I'm really glad to see all this new money coming into psychedelic research.
Yeah, no, I mean, I'm always, that, like, it's a little bit like when we two have a conversation, it's like in a lot of things there was this heated patent discussion when was it, in March, I think. Yeah, but we don't have that, meaning I think we have sort of sometimes different opinions on nuances, but not the super big different opinions. So we need to somehow now have a discussion, because I think that's what people expect. I have a little bit of two opinions, although we actually are very close to each other. So it's hard without a moderator who's poking us, because I always want to say, oh, Rick is great. And so where do we, yeah.
Well, I'll just say, so the idea of patents and IP. So I'm completely supportive of patents and IP for novel inventions. But I think sometimes what we see is in pharma, it's sort of standard playbook where people try to make overbroad patents and then see what sticks. And what I've heard the saying is that the people that win patent fights are not the people that have the best claims. It's the people that have the money for the most lawyers, because it can be very expensive to defend. So I think that's where there's a big concern, is that overbroad patent claims that are designed to sort of obstruct other actors, and even patent things that have been used as prior art for decades, half a century even. So I'd say that's where we might have a thing. And I'll say one thing that you said, Christian, that was sort of scary to people, was that I think in one interview you said that in the end it'll only be Compass and Atai, because you'll have everything locked up with patents. And so that was
yeah. Well, I would say it a little bit different. I do think that in the psychedelic field, and I'm phrasing it carefully, because as you and I, meaning I welcome every legit player. I also don't see a risk, meaning, and again, at the end, I'm always coming from, and that's already maybe a definition we should make. What do we want to achieve? Yeah, and I know on our list is like the topic of decriminalization versus legalization, whatever. So our view, and that there we're very stern, is like at the end it's about the patients who really need it. Yeah, so that's sort of my overall view, and for the patients to need it, it needs to be medically available. For being medically available, yeah, you need to have all the regulatory processes. May you like it or not? Yeah, I always say we can have another discussion if this should be different, but then we're becoming quickly in sort of a very substantial, how can we change the world discussion. Yeah, so if I stick in the sort of existing framework, yeah, if I want to approve medical drugs in the existing framework, it's pretty expensive. Yeah, and therefore I need capital, and capital I just get if I can make a business model out of it. So I need to sort of secure it, yeah, with patents around it. So full stop. So what I said in that interview was that we started very early. Yeah, I would say Atai and Compass together on the economic side, meaning I'm always pointing out you were earlier. Yeah, but on the sort of for-profit side, I would say we sort of reinvented, because I also don't want to say invented because there were Sandoz in the last century, but we reinvented the sort of for-profit psychedelic business in this century. Yeah, and because we were so early, because it took like almost 2 years till other people were like starting doing something as well, and because we had a lot of money early on, because I invested a lot of money myself, and I sort of had the unusual luckiness that I'm in the field of biotech, so I was able to mobilize a lot of capital. Yeah, we looked at, from my point of view, everything which makes commercially sense. Because, for example, there are great drugs, which I would always say, on a sunny day on the beach, in a country where it's legal, I might like these drugs a lot. But we don't see the commercial sense. We don't see it, not even from a patent point of view. It could be because it's hard to get patents around it, but it could also be that we say, hey, in the clinic, drug, let's say LSD doesn't make sense from our point of view if you have psilocybin and other drugs, yeah, and which are shorter acting whatsoever. So, but what I say is, what I said in the interview is that because we were early and because we had capital from the beginning, which others didn't have, yeah, and because I don't think we're dumb, yeah, I think we sort of mapped out the world or the landscape in psychedelics pretty well, considering again what makes sense in the clinic, not for private use. And everything I wanted personally to have on the atai platform, we do have. So there is nothing which I'm missing, and I'm looking a lot left and right, and I see a lot of people doing stuff, which doesn't surprise me because we looked at it. So we looked at LSD, we looked at 5-MeO to inhale. Doesn't make sense from our point of view. We can be wrong, by the way, yeah. But like, so this is why I said maybe a little bit cocky sentence that I think, because I do think we have everything makes sense, that we sort of gonna be the number one, and I say atai and Compass together because I see us sort of as a unit. Yeah, we're gonna be or as a family, the number one player. That's what I said. So, and I think obviously that what we think last sentence makes sense, we secured with patents because I think that's sort of the basis for a for-profit model.
Yeah, so I'll say that in contrast, while I share the view that we have to do what's for patients, that one of the goals that we have is to provide new treatments for patients, and that we need to work through the regulatory system and we need to amass large amounts of capital and all of that. But our other goal, or I would say even our primary goal, is what I've been calling mass mental health. That I think this sort of in the save the world kind of context. You know, that I think
very fond of it, like.
Yeah, because I think humanity as a whole, as a group, is very self-destructive and destructive of the environment, destructive of the climate, destructive of a lot of species, and we need to spiritualize humanity. And I think that's the kind of overarching goal for us. And the medicalization has to make sense in and of itself through science, through proving safety and efficacy, but it's a part of a larger strategy to help us not destroy ourselves, and to, you know, with these incredible weapons of mass destruction that we have invented and the, you know, amazing science, but we have technology that we don't have the emotional, spiritual maturity to handle. So that's where, for us, this idea of decriminalization leading towards legalization is a goal as well. And so I think I'd like your opinion on this. One of my views is that there has been some concerns about for-profit companies being against decrim or legalization, because then it provides people with access to these same substances for a very low amount of money, but they don't have the insurance coverage for the therapy component. But that my sense of it is that even with legalization, where you could buy drugs for $5 or $10, that will destigmatize this whole area, and that we will try to have harm reduction and train people how to do their own psychedelic sessions or have peer support. But I think in the end that would actually increase the demand for people with serious problems to go to clinics and train professionals covered by insurance. So I think that the legalization, the Decrim and then legalization will actually increase the business for psychedelic clinics and psychedelic psychotherapy, rather than provide an off-ramp for people to buy the drugs, cheaper. And so I wonder how you think about that, because I think that if you see that as competitive strategies, then you could be concerned about Decrim and legalization. But if you see that they're synergistic in a way, then you could be in favor of both of those.
Okay. So you touched this, why when I look down, I'm making notes, because you touched a lot of points, first of all, which I love to discuss. So it's my favorite topics. So just because there were 4 or several things so the one is maybe as a very important thing, and I hope you believe me because we know each other and whoever is watching, so 100% my opinion on decriminalization and legalization is not driven by economic. By the way, neutrally, for one simple reason, I always pointed out, look at the Netherlands. In the Netherlands, it is already in sort of this gray zone, that as magic truffles and not everything, but there are psychedelics commercially available. So you can go to a coffee shop, buy magic truffles, and the Netherlands have the same amount, exactly the same amount, pro rata in percentage of any mental health issue than any other country in Europe, which tells me there is almost to non-overlap between the sort of recreational market, do it yourself, and between the medical market. So I really, really don't, from an economic point of view, have sort of my sort of business atai influence my personal opinion on decriminalization or legalization. So again, trust me or not, that's really the truth. So everything I say now is really my opinion. I know you want to have nuances different, but it's really my opinion. So my opinion is, and I know where to start. It's first of all, I'm for decriminalization. So by the way, atai, this is my personal opinion, because as atai, we say we stay out of that discussion. We're a medical company. It's always very, but I'm the type of guy that says I have a personal opinion. Just because I'm the chairman and founder of a company doesn't mean I can't have a personal opinion. So my personal opinion is I am for decriminalization. Because by the way, it would be incredibly hypocrite, because I go to countries where it's legal and do it and so on. Hence, nobody, by the way, for any drug should go to jail or whatever. And we should, this is another thing. And by the way, not me, but one of our bigger Thai shareholders, and a big shout out, and you should, by the way, connect, Mike Novogratz, is doing an incredible amount of work to get people out of jail who have been in there for cannabis or whatever, which is insane, by the way, that we changed so much on the cannabis side and we still keep the people who are mainly minorities, by the way, in jail. Side note, but that is all insane. That is all insane. However, and you know that I'm personally extremely on the spiritual side of that stuff. So I believe these are religious drugs. And if you look in the history, and by the way, the 60s might have been an exemption, in the history of psychedelics, most sort of famous use cases, from the Eleusinian Mysteries, the Sekhmet cult in Egypt, anything, it was always a sacrament, like a religious ceremony, a guided thing. It was never pop it on the weekend because somebody sold it to you for $10. So, and this is what I think it should be. So in a decriminalization world, and I believe very much in the ethos of effort in anything in life, by the way, nothing should be for free, because then it becomes, I don't know the English word, it becomes, I don't know the English word now, but it becomes meaningless. If you can have it for $10, it's meaningless. You might try it, you might not, you can have a bad experience. So in effort must not be financially, but for example, if somebody grows mushroom at home, I think this is almost a little bit over saying now, but like a sacred thing. You grow something, you put effort into it, you put time into it, you put consideration into it. And I think that is a limiting factor. And I know a lot of people won't maybe agree with me, but I do think they should be limited because they're so valuable. But the limitation should not be the medical side, but the limitation should be that somebody puts effort into obtaining the drugs, because I assume somebody who grows mushroom, him or herself, is also a little bit familiar with it. But I do not believe they should be just available because, and now coming back to the medical side, in the treatment, in our studies at Compass and atai, and then several friends of mine have, this is what makes me so confident, by the way, like it does you, yeah, I have round about 20 friends of mine who over the last years have really found healing. Yeah, and by the way, 100% success rate from complete healing to at least very much big relief, yes, which by the way makes me and you so confident about these drugs. But I also have seen that with these people who have an issue, might it be a trauma, pain, or whatever, yeah, the trip in itself, which by the way is a little bit different with MDMA, yeah, because it's not a trip, yeah, but like with the real psychedelics where you have a trip, yeah, the trip can be incredibly challenging. And if these people had not have a proper guide with them, or me, yeah, it could have gone really wrong, yeah. So, and I'm wondering always when I see this sort of, again, and they were all helped, so it was great, but the trip in itself, they needed somebody who does it with them. If somebody who might have an issue reads somewhere, oh, psychedelics are help, yeah, and they are then sort of, again, getting it somewhere around the corner, yeah, that can go incredibly wrong. Yeah, yes. And I don't want that, because that, again, that wrong thing would set back every other effort we have.
Okay, so
the last sentence, by the way, we could that is my opinion now, and I'm very firm in it. Not that I want to discuss it, but like I really believe, I thought a lot about it. I'm not making all what I just said lightly, but what I'm also saying, we can check it again in 10 years, because the life is long. You know, I believe in longevity, and let's get it right now, because as much as I think people like Timothy Leary or other people have done right because they also have done a lot wrong, yeah, because it was done too sloppily, it was done too crazily. And what I believe, I love politics, the world is like, or the society is like a rubber band. If you hit too hard, it really comes back and hits you back. Let's go step by step. And I think the great thing with medical use is that we can all agree on. If you have seen people who have treatment-resistant depression, yeah, or any other form like you do with PTSD, whatever, and they are helped, we all can agree on that. We all, I mean, not just you and I, but if we show that to a politician, if we show that to the press, if we show that to the biggest critique, they will say, wow, if you can help these people, that's really valuable. Yeah, let's get that done. Okay. In parallel, and then let's get Decrim done, because then a lot of people already can do it because they are sort of in the community. And if we then in 10 years maybe say, hey, let's revisit that thought, all right? But one step after the other, because again, short version, I fear if we would do wider legalization, it could be very detrimental and bad for those who really need it, and it could push back the whole effort.
Okay, so my first off, the response to the 60s, I don't think it was an exception. I think to this idea of these drugs being used in sort of spiritual religious senses. So that I think what we saw in the 60s, and I'm older than you and was, you know, young during that time, but my sense of it is that the traditional rites of passage and the traditional religious services failed to spiritualize a lot of people. So I joke and talk about how my bar mitzvah failed to turn me into a man. And I really thought that it would. So I think that what happened in the 60s with Timothy Leary, the Grateful Dead, the concerts, that those were a different kind of spirituality for people, a different kind of community. The doses of LSD at the time were 250 micrograms, where you would have kind of existential experience. And so I think on the outside, it may look like parties, but I think on the inside, for a lot of people, it really was spiritual, and that it was new forms of spirituality because the old religious forms weren't working for people. And the narrative that things went off the track and psychedelics went wrong, and that's why we had the backlash, misses, I think, the main point, which is that it was psychedelics going right and people having this sense of spirituality, and then questioning, why are we as Americans going to kill people in Vietnam? Why are we having that conflict? Why are we not seeing the commonalities that we have with other people. And it was people that then, through the spiritual experiences, had a different approach towards life and death, weren't as scared of dying, and got more involved in challenging the status quo. So I think it was psychedelics going right that caused the counterculture and caused the backlash. And the cover story is, oh, this is about trying to stop drug abuse. The other part, I think, is that legalization, there is a big distinction between Decrim, where you don't go to jail for it, but there's not pure drugs, you can't buy them, and legalization, where there is some sort of legal access, and then even harm reduction and education, things like that are much more difficult under Decrim, but they would be possible under legalization. So for example, right now we're working with the city of Denver, where they've made mushrooms the lowest enforcement priority, and we're doing a training program with their police about what to do when they encounter people with difficult psychedelic experiences and how to support them, not tranquilize them, not necessarily arrest them. And so if that goes well, the city of Denver wants us to train 4,000 of their first responders. So I think that in a legalization world, there would be a lot of education, there would be a lot of harm reduction, treatment on demand. And I also think that the risk that you talk about bad outcomes, I think that is, I don't share that concern, because there will be bad outcomes. But I think people have learned enough to say that what we do in a highly controlled, medicalized setting with trained professionals is separate than the risks of people doing this on their own. So I don't think that there will be a backlash, and we haven't seen that yet. I mean, for us, for MDMA, people have taken MDMA and died at raves from overheating and dying from hyperthermia. And people have heard, oh, you need to drink water so as to cool down, and people have died from drinking too much water. And people have had emotional breakdowns from doing even MDMA at raves, where trauma comes up and they don't feel ready to talk about it and they suppress it. So those kind of bad outcomes, I think, have been in the culture for 40 years or so. And so I think that problems there are not going to translate into slowing down for medical research. But I also think that the drug war is a fundamental violation of human rights. And but in any case, I think this other question is that even if there is,
I agree, but I disagree on what you said first, because I really like, I know you're gonna answer, because I know you're good at arguing, like I'm a libertarian, but unfortunately I do see as well, like this is a very, very positive view on knowledge transfer. People don't get alcohol right, yeah. So and again, by the way, can we someone revisit that? I say hopefully society is changing, but I think it's one step at a time. So where I do agree is that the war on drugs is crazy. This is why I would decriminalize it, because that would end the war on drugs. Yeah. So I just don't think all these drugs, at least not the religious ones, should be available on every corner. A, for spiritual reasons. B, for because, by the way, and again, I always want to add, everybody can make it in a Decrim world. Go and get your greenhouse. Yeah. But that's my spiritual view. Like, I want people to put an effort in it and to think about what they are about to do, which is a very deep spiritual journey, and not a rave. I'm also, by the way, and I know I'm gonna hurt now many things, like I'm against the rave use of anything. I'm against psychedelics and Burning Man, and some of my closest friends do it, and they will say you're wrong. In average, because I think.
Okay. Well, one of our projects. Yeah. Okay, so at Burning Man, so I totally agree. Since 2003, we've been going to Burning Man every year that they have Burning Man.
And my own colleagues were at Burning Man. I met you there, so it's like, yeah.
And we have this program we call the Zendo Project, which is psychedelic harm reduction. And so we offer support to people that have psychedelic experiences that get more difficult than they thought they would. And the last year of Burning Man, 2019, we had over 550 people come to us wanting help for their psychedelic experiences. And when they get into a safe, supportive context with our trained Zendo volunteers, they actually learn a lot from it. And a lot of people.
But now is there a kid in Ohio who doesn't? I hear you, but it's a chicken egg situation. And by the way, hopefully that solves this again step by step. if obviously, of course, if society thinks more about that stuff, and the more Michael Pollan writes about it, and the more trained people we have out there, and the more the police is trained, we can revisit that discussion. But why? The only thing I'm saying, like, if, and this is, by the way, about my view on many things in cultural change, if you do things too much at the same time, too quickly, it's gonna shit in your face. Yeah. So, and I don't want that, because I think these compounds are so valuable. Yeah. So let's get it right.
Okay.
Well,
Well,
we don't disagree a lot. Like we almost. Okay. Yeah.
We can wrap this part of the discussion, because I'll just say I continue to disagree. I think that we must move forward with Decrim, with legalization, and with medicalization simultaneously, and that the vast majority of people that have these experiences outside of a medical context, that they do approach them, even though if you can get the drugs, even with Decrim, you're not going to be able to get the drugs, pure drugs, easily, because Decrim doesn't have legal commerce, doesn't have pure drugs, so people still have to search for it. But I think we need to educate the population about the psychological consequences and the need to prepare and the need to have support. But so that's it. And I do think legalization will increase the business of medicalization. That it'll
before. By the way, there I agree again. I think both decriminalization and whatever legalization ever comes, but like I don't think it hurts the medical side and the business side. It might even foster it. So this is why I'm saying everything I just said was a personal opinion out of my personal view on these substances, was not an atai business-driven opinion.
Okay. Now, the other thing that I guess I worry about now is, in terms of the medicalization, is that the big issue is going to be the amount of therapy that's provided to people. And that's the big cost. I mean, the drugs will be priced according to their value, not according to the cost of the drug or even the cost of the research. You know, we've recently hired Boston Consulting Group to do a study on our path to commercialization. And one of the things that they recommended, you know, if we were big pharma, that we would choose a price somewhere between $1,000 and $6,000 per dose, and that we could justify that to insurance companies on the amount of value to the patients, value to the healthcare system, value to society. So what I'm concerned about, though, is the pressure that might come to reduce the amount of therapy that's provided in order to make the total treatment less expensive. And I know that you can do certain things with digital technologies, but that's where we focused on maximizing patient outcomes. And we are now the only company in the whole field in phase 3. We've completed our first phase 3 study. We anticipate by October 2022, we'll have completed our second phase 3 study. But we have 42 hours of therapy with a male-female co-therapy team. And we're getting 2/3 of the severe chronic PTSD patients, most of them treatment resistant, no longer have PTSD at the end of our treatment. So that's my one concern about medicalization, will be a focus on minimizing the amount of therapy, which in some ways makes sense, so that then the lower cost and you get more people access to it. But I worry that in the rush to try to minimize the amount of therapy will end up reducing the efficacy, and that will be a problem.
Okay, quick, because I see the minutes counting down. I don't disagree there. I have not had the feeling. I also have to say, like, I'm sort of the founder, but like, we're a big team. But like, I don't have the feeling that in any of our studies with various psychedelics, we try to reduce the amount of therapy, because I do agree with you. This is why I said what I said before on the non-legalization thing, that these drugs really unfold their full value together with therapy, and that the therapist has a super important role, So full stop. Like, so you were right. Like, we don't disagree on that. We need to find out. Obviously, we as a for the healthcare system, you want to find the right amount. You don't want to say, okay, let's add another 10 hours, like, if you don't need it, But like, I do 100% agree on the importance of therapy. And by the way, I do 100% agree on the importance of human therapy. We can support that, what we also do with digital therapeutics, but they cannot replace the human guide, from my point of view.
Okay, yeah, and one of the things I worry about is esketamine. being administered without therapy. So esketamine for depression has been, approved. Johnson & Johnson approved it without any therapy at all. And the results are not as good for the patient outcomes when you don't surround it with some sort of preparation and integration support. And ketamine being the most addictive of all the psychedelics, because it's more of a reliable escape. So I am concerned. I mean, a lot of people are having benefits from esketamine, and that's really good to see, because it takes.
So again, by the way, same opinion, just nuances different. It's like, I do agree on that. Again, if you take it's a little bit like with any painkiller, and we know that the US especially, and people, it's unfortunate, are always addicted to the cheap painkiller and not solving the problem. So in a simplified way, I would say ketamine, the whole family, we're also working on one form of R-ketamine, is like a quick fix. Quick fixes, which is not a cure because it doesn't go where the problem is. But quick fixes are important because some people with free will, some people want a quick fix. Some people might not get a therapist. Let's also not forget, and there, by the way, I really, really value what you do. I know we want to do that together, because there will be the bottleneck of training all the psychotherapists. And even if we train everybody, my view is we have too little then therapists still worldwide, meaning we can train the ones who are there, but we need more people. So that, I think, is one of the really jobs with a future, so to say, because we need more of them. So coming to ketamine, if somebody wants a quick fix because he's suffering at the moment and can't get an appointment, whatever, I think ketamine is incredibly helpful, especially when it can be used kind of without a therapist, because that might be the bottleneck. I would always encourage then every patient to say, hey, but don't rely on the quick fix all the time. See it as maybe a bridge to really going to solve your problem.
And I think one of the ways that we can collaborate is on this whole question about the training of therapists. And so we've now, because of COVID, have developed an online approach, and we have 100 hours of therapy, of training online. Also, we believe that therapists should be able to legally volunteer to receive the drug in a therapeutic setting that they're going to give to patients. We think that's very important. And we want to supervise therapists as they work with their first PTSD patients. And so we've now developed a plan in the first 6 years post-approval to train 24,000 therapists. And the therapists, though, are not interested in just being an MDMA therapist or a psilocybin therapist or a ketamine therapist. They want to be psychedelic therapists, and they want to end up having the full range of training so that they can customize the treatment for the different patients. And they might do a sequence of drugs. I also want to just comment briefly about LSD, in that it does last longer. I think it may be more effective. Stan Groff, who today is his 90th birthday.
Oh my God. Congratulations.
Yeah. And there's actually ceremonies for him right this moment. But today is his 90th birthday. And one of the things that he has talked about is that the length of time in the therapeutic session is sometimes an advantage. It's harder for the therapist, but there's a phenomena that we talk about called neuroplasticity, where psilocybin, MDMA, LSD, they actually promote new neural connections in different areas of the brain. And they permit you to sort of route around memories, traumatic memories, and rewire your brain. And so there's neuroscientists that have suggested that the longer you're in the psychedelic state, the more neuroplasticity there can be, and therefore potentially the more therapeutic outcomes there can be. So I wouldn't automatically discount LSD, and I would say
I would say, but at the margin, like if you have psilocybin and LSD, I think at the margin, again, focus on, that is sort of the commercial decision as a business on what is sort of fits in an existing healthcare world. I always add that I personally don't discount LSD, especially and the rest I agree, but I especially also agree positively, and you phrased it right because we had this positive discussion. I do think everybody who is a therapist for psychedelics should have the legal access to try it him or herself. Because I don't know, it's a little bit like with my gym trainers, like I always pick the ones who look like I want to look. So I'm not like, I think we have the same opinion, like you can't, we have to say maybe you can, but like I would highly think or suggest that somebody should have had the experience you want to guide other people through, and we need to find a legal framework to make that happen.
Yeah, and actually that's the most expensive part of our training, is because the one therapist sitting there with receiving MDMA with two therapists supporting the process, that is the most expensive part of the training. Because the other part, we have 310 therapists going through our training right now. And in September, we're going to start with 500 therapists during this process, but then giving each one of them the opportunity to do MDMA, and then giving each one of them the opportunity to be supervised while they work with their first PTSD patient. That's going to be a challenge. And so we can develop modules we'd like for psilocybin, for ketamine as part of our training. So I think that's where we can find a good way to collaborate, because I think we do need more trained therapists, and that will be the limiting factor. But there's much more of an appreciation now for the cost of mental health, and hopefully that will translate into higher insurance reimbursements for mental health. A lot of therapists don't even take insurance, so that's going to be a problem to solve. We don't want to leave it just for self-pay people. And the other big thing, just as I know we're running out of time, but I'll just say the difference between patents and data exclusivity. And so we're working with drugs that are in the public domain. We've had an anti-patent strategy for use patents, because these uses have been for decades and decades, even with MDMA, with psilocybin, with LSD. But in Europe, it's 10 years data exclusivity. In the US, it will effectively be 6 years. And so we feel that while that's shorter than a patent life, it's enough time to recover enough money for investors, or for us to raise more money to fund more research, because we have MAPS and the MAPS Public Benefit Corp, which is our for-profit arm, 100% owned by the nonprofit, supported all by donations, that this idea of patents are fine for new things, but I am worried about aggressive, overbroad patent claims. And so I think that in Europe, particularly with 10 years data exclusivity, that should be enough to motivate investors to say, and the difference between patents and data exclusivity is that some other companies can develop their own data, so that you don't block other people. And one thing I just want to make clear is that Empath Bio, which is a part of atai, which is to develop MDMA-like drugs, that we're completely supportive of that effort. And if there's different ways that you can find to tinker with MDMA-like molecules and come up with ways that are either shorter or more effective or more help people overcome fears better, since our goal is more mass mental health and helping patients, if you can, you could say, develop improvements on what we're doing, we're completely sympathetic with that. So cool. That's
maybe it's closing, because I know they want us to close it, but like one important thing is, if I can always repeat, we both are anyway close together, but like, and I always say, like, as long as we move forward, it's great. Yeah. But everybody who disagrees, always, I want to say at the end, when I'm on a panel with you, who disagrees with me on the commercial approach, give money to Rick. The only thing I don't like when people are hypocrite and say, oh, you shouldn't do it commercially, but I'm also not supporting Rick. So you have to pick one. I don't think there is a side, but if somebody wants to pick a side, and give money to Rick. I can't say it now himself, but like, it's on the website, and you can donate to him.
Yeah, thank you very much, Christian. And just to be clear, I'm totally supportive of the for-profit approach, because the scale of the problem is so great that we need even more resources than you've been able to generate so far. We need a lot more research into this area, and we have incredible mental health problems all over the world. And just in terms of climate change refugees that we're going to have over the years to come, we really need more. And I think we need everybody, both investors and donors. And so I'm applauding the success of your IPO, and I look forward to the work that you do. And we will accept donations from people if they want to do that as well.
Exactly. Cool. Thank you, everybody, for watching. Thank you, Rick. Pleasure always.
Yeah.